talk about prostate, see, the most common presentation for the patient to us is difficulty in passing urine.
Yes.
Sometimes they complain of blood, sometimes they say of double stream, and most of the patients, male patients coming to us are in the late stage of the disease. So it is a very high time that we have a proper awareness regarding men's health also.
Welcome to Brainwise with Dr. Pallvi Prasad. Today at our studio, Dr. Himesh Gandhi is here. He is uro-oncologist. Welcome, sir.
Thank you,
Namaskar.
madam.
Yes. Sir, what are the most common urological cancers you treat and how do they affect patients?
Uh, to begin with, uro-oncology is a specialty which is like since last I would say 10 to 12 years has flourished widely in India. Uro-oncology basically deals with all the cancers of genitourinary system, which includes kidney cancer, prostate cancer, urinary bladder, testicular tumors, penile cancers, and certain aspects of retroperitoneal tumors also. So now urology has flourished in India across most of the major cities, and if we see the statistics of India, there are some of the cancers which are very much common in males. Predominantly, we call it as a prostate cancer, which is routinely now seen in almost all cities of India, and it is widely distributed in our population.
And what we see usually breast cancer and cervical cancer promotions are more.
Yes.
But we need to promote these male cancers also. So please tell us about how important is early detection in cancers like prostate, bladder, and kidney cancers.
So, Dr. Pallavi, your point is very valid. What I would say is the males are the most neglected element of our society because most of the focus goes either on females or pediatrics.
Yes.
But when we concern with male as a population, so we pay very much less attention to their conditions, their
Yes.
problem. So, for an
And
instance,
males don't talk also much.
yeah, so that is the mentality across the society is that males have to be like the top of the ladder and they are the breadwinners, and so
Yes.
they are more focused in earning and rather than focusing on their health.
Yes.
So predominantly now when we see in our male population across India, we have a very high incidence of prostate cancer.
Yes.
And most of the cancers what we get are in stage 2, stage 3. So this is purely because of the neglect the male have towards their own self, and they don't come to us in proper time, and most of the patients, male patients coming to us are in the late stage of the disease. So it is a very high time that we have a proper awareness regarding men's health also, and that is why we have some campaign running through, in the month of November. We call it Movember.
Okay.
So it is just to implement improved and increased men health awareness across the male population of India, and to do certain tests which will help us to diagnose the cancer or any other conditions.
Which are these tests?
So the test what we normally include in this kind of we call it as a screening.
Screening,
So
okay,
screening
yes.
we do some test called PSA.
Yes.
At Ruby Hall we have something which is more advanced called as PHI. It is Prostate Health Index. That was the first test to be introduced across India in Ruby Hall Clinic in 2017. Once I came back from Singapore, and we were the first center across India to do this Prostate Health Index, which is simple blood-based test, and it is more accurate, more sensitive and specific regarding diagnosis of prostate cancer.
Okay. And the age, what age we should do that screening?
So when we talk about screening is, what do you mean by screening?
Yes.
Screening means what? That we diagnose a disease before it has actually happened inside the body, and we diagnose it in an early stage so that
Yes.
it has not spread outside the confined organ.
Yes.
Now, when we talk about screening, we have the certain age criteria. Like when we talk about prostate cancer, screening for prostate cancer normally should start after the age of 50. Okay. Now, when a patient has a family history of either a breast cancer, in mother or sister or any maternal relative,
Yes.
similarly cervical cancer, or has a family history of prostate cancer itself.
Yeah.
In those patients, 40 to 45 years of age is considered to be an ideal for screening. Certain African American, we rarely get such kind of like mixed breed population,
Yes.
but in those category also 40 to 45 is the recommended age of screening.
So, how can men can take better care of their prostate health?
So
What we can suggest to males?
so when we talk about prostate health, we have to understand that what kind of diet we follow,
Yes.
whether we are smoking or not, then whether our water intake is adequate or not, because we are in a hot humid climate.
Yes.
Across India we see it's mainly a hot climate, so we are more bound to have chronic prostatitis, especially males in India. So for that, proper nutrition, avoid smoking, adequate water intake, all these things are helpful, and a proper, I would say, vegetable diet rather than a red meat or a more of a non-vegetarian diet. So these are some of the factors which will help us to reduce the incidence of prostate cancer.
How much is the alcohol affects?
Alcohol directly doesn't have a correlation with prostate cancer as such.
Yeah, okay.
I would say, in fact, smoking or tobacco consumption in any way is directly correlated with prostate cancer as well as bladder cancer.
Okay.
So these are the two environmental factors which can be modified and we can reduce the incidence.
So we are talking about age. So how genes or genetics affect to prostate cancer or any type of bladder cancer?
This is a very excellent question, because I would say in India, genetic data is very less available.
Yes.
So that is why in my further answer also I mentioned that if a family history of a male patient, a mother or a sister is having a breast or a cervical cancer, we call something as BRCA1, BRCA2. So these are the individuals who are very much at high risk of prostate cancer. If a brother or a uncle or a father is having a prostate cancer, then that individual increases the risk by 2 to 3 times of having prostate cancer. So this another, some patients have colonic cancer, so they have some syndrome which what we call it as a Lynch syndrome. So they are directly associated with having a high incidence of prostate cancer. Similarly, if we talk about bladder cancer, the genetic role has been quite limited, and it is mainly the environmental factors which cause bladder cancer. Similar
Or
genetic.
comorbidities.
Sorry?
If they have heart disease, they have diabetes.
Okay.
So they
So-
can get that type of.
So I would say that, see, genetic transmission of diabetes, heart disease, cardiovascular problems, that is directly correlated. But as such, those conditions have not been linked to having increased risk of either any type of genitourinary cancer. In fact, I would say that kidney cancers do have a familial presentation.
Okay.
So those there are certain conditions like familial adenomatous polyposis, that is a colon-related cancer. Then patient having a tuberous sclerosis. Then patients having VHL, which we see very rare in India. It is called von Hippel-Lindau syndrome.
Okay.
Those patients have adrenal tumors, pancreatic cancers, kidney tumors. So that is a direct 100% transmission when we talk about genetic transmission. So these are the genitourinary tumors which have some correlation with genetic factors.
Now we are talking about prostate. So what type of diseases we can diagnose for prostate because of age, apart from cancer?
So when we talk about prostate, see, the most common presentation for the patient to us is difficulty in passing urine.
Yes.
Sometimes they complain of blood. Sometimes they say of double stream.
Yes.
The most another symptom what they come across is frequent waking up at night. So
Yes.
when these all problems comes to us, we first analyze whether patient is having a prostate enlargement or not, whether he's having UTI or stones or any other co-founding factor which can have this problem of difficulty in
Mostly
passing urine.
elderly people have this problem.
Yes. So once we isolate that, okay, he's not having a prostate cancer based on PSA reports, and we make a diagnosis that okay, he's having either a prostatic enlargement, or he's having a chronic prostatitis, or an infection in the prostate, or some urinary stone which is blocking the prostate mouth. So this all based on the evaluation we identify first, and then we give a proper suggestion regarding the particular management.
And what type of treatments are available for this type of problems?
So if we just leave the cancer part apart,
Yes.
now the discussion for males, when we
Yeah.
concerned about urinary problems,
Yes.
we focus more on the bladder health.
Yes.
Means previously there was a dictum that people used to say, oh, your prostate is enlarged, get it operated. But that is not the case anymore, because a patient having a very small prostate will have may have a lot of urinary problems,
Yes.
rather than those having big large 100-gram prostate but no urinary problem. So it depends on how good is the bladder health, and whatever intervention we select, we are trying to preserve the bladder health.
Yeah.
Because bladder is like heart. If the heart stops pumping, we know what happens. So similarly, if the bladder gets damaged, the pumping function is affected, and if the bladder is not able to pump, the patient will not be able to pass urine. So the main focus now comes on the bladder health, rather than just treating or doing surgeries for prostate.
So what type of procedures or treatments are available?
So if we have isolated everything, that now the normal enlargement of the prostate is only the cause for all his problems, then we offer something we call it as a minimally invasive surgical treatment options for prostate.
Yeah.
Short form is MIST.
Yes.
Now this MIST includes few modalities, like one we routinely practice in Ruby, and we were the pioneers to start, is something we call it as urolift.
Yeah.
Then another one is a resume. Then if the patient is not fit for both of this, then we give options of laser therapies, and sometimes in very large prostates like 150 200 grams, we even offer robotic surgery.
Okay. And for this treatment, before mentioning the treatment or prescribing the treatment, what type of test they should do before?
So when a patient walks to our clinic at Ruby Hall, we have a set of proformas what we need to ask the patient. We have a questionnaire where he can chart out all his problems. We analyze it. We identify whether the bladder is the problem, the prostate is the problem, or the urethra is the problem. Based on that, we do some uroflowmetry tests. We do PSA, ultrasound of the abdomen, pelvis, and we look for a post-void residue. We also assess their erectile function and any other associated problems. So once all these things are charted out, we come to a conclusion based on all the findings, and which will be the best option for that patient.
Now we talked about non-cancerous diseases. Now we are moving to cancers. If someone has prostate cancer, kidney cancer, or bladder cancer, how we diagnose and what are the treatments are available?
So, like we discussed in the previous discussion, that now predominantly the patients we get over years is diagnosed case of prostate cancer. So majority are diagnosed outside and then referred to us for further management. At our center, once we have a patient coming through and we suspect a prostate cancer, we have in-house facility where we do a PSA, PHI, like I told you. Then we have an MRI, and then we do an MRI fusion biopsy at our center. So all these facilities helps us to diagnose the correct stage of the disease.
Yes.
Once we identify that okay, the patient is having a particular stage of cancer, we need to make sure that okay, he is not having a metastatic disease. For that, we have an in-house PSMA PET scan for prostate cancer. And once we make sure that okay, it is in a curable stage, we make a plan for surgery for those patients. Predominantly, what we do for prostate cancer is the robotic surgery. Now, the advantage of robotic surgery is that once the prostate is out, you get at least 20-25 years of cancer-free life.
Oh, great.
After surgery, because the prostate is removed. The morbidity of the surgery is not much. The surgery hardly takes 1.5 hours, and within 3 days you are out of the hospital, and for rest of the life you don't require any further treatment in terms of chemotherapy or radiation, and patient can live as normally as he was before. So that is why screening and diagnosing in an early stage, especially in Indian males where the cancer is quite a high risk cancer, aggressive cancer, this options gives us a very good long term cancer free survival when we are talking about curing a patient.
Yes.
Similarly, when we talk about kidney cancers, now interesting thing happening in kidney cancer is that because many IT companies have included ultrasound in their health checkup packages,
Yes.
now we are finding a quite high incidence of incidentally detected kidney tumors.
Okay.
So what is incidentally detected means the kidney tumor has not shown any symptoms, patient is completely asymptomatic, and now because of the ultrasound we are able to pick up the tumor.
Yes.
Normally the size of such tumors are less than 7 centimeters. So in those conditions robotic surgery helps us to save the kidney. We do something, we call it as a partial nephrectomy.
Because
So
kidney patients don't get any symptoms.
yes,
Yes.
because if the patient gets symptoms, then those tumors are stage 3, stage 4 tumors,
Yeah.
and they are not in a curable stage. So luckily for us, because Pune has a big IT hub,
Yes.
so we get lot of incidentally detected kidney tumors, which are early stage and are 100% curable. The 5 year survival is more than 95% for such patients.
Yes. And we were talking about
And
urine.
yeah, another cancer what we talk is urinary bladder tumors.
Yes.
Now we have to see how the socio-economic status affects such disease, because when we talk about bladder tumors, they are mainly predominantly seen in a lower socio-economic status
Yeah.
because of increased consumption of tobacco,
Yeah.
either in any form, either BD or the gutkhas, or some people apply paste and all that. These
Yes.
are directly correlated with the incidence of urinary bladder tumors. So it doesn't mean that it doesn't happen in the affluent class.
Yeah.
Now, if we see the persons who are affected in the affluent class, they are mainly those people who use frequent hair dyes. Those who are working in some areas where they have direct exposure to chemicals and toxins,
Okay.
which are arsenic mist. So these are some of the conditions, environmental factors which predisposed a patient for urinary bladder tumor. Now, bladder tumor are bit tricky because, like prostate and kidney, the cure to attain a cure you need to act early. Most of the bladder tumors what we see in India, they are high risk, high grade tumors. So if we opt for an early removal of the bladder, that gives us at least 15 to 20 years of cancer-free survival when where we are able to cure such patients. If the patient comes in stage 2, stage 3, then we have to give chemotherapy, downgrade the disease, and then do the surgery and remove the bladder. So all these things depends on what stage the patient is coming to us, how actively we diagnose, treat the patient. Advanced cases definitely have a poor survival and they are not curable. Also, India is a cost sensitive market. So for us, early diagnosis and early management makes more sense rather than going for advanced cancers, then a lot of chemotherapy, immunotherapy, hormonotherapy, which are exuberantly costly.
Yes. So you just mentioned ki, robotic surgery and all. So how these robotic surgeries are beneficial, and what is the role of AI in those robotic surgeries?
So robotic surgery is nothing new now. I would say the first robot was established in All India Institute AIMS, New Delhi,
Yeah.
in 2007. So if we take from that time, we are talking around good, I would say 18 years now
Yeah.
of having robotic system in India. At our center in 2017, we introduced the robotics system, which was first in Pune
Yeah.
and only center outside Mumbai.
Yes.
So we had been quite fortunate that we are able to deliver some good results
Yes.
with robotic surgery. The benefit to the patient is that, see, this is a minimally invasive surgery. It has a high precision, it has a 3D vision, and 10 times magnified vision. So what you see with a normal eye, the robotic system amplifies that vision and magnifies it to up to 10 times the normal
Yes.
eyesight. So this gives us absolute precision, minimum collateral damage, minimum blood loss. The instrument goes through an 8 mm cut inside the body. So this 8 mm is hardly anything. So where a patient would require initially 30-40 centimeter cut to do the kidney surgery or a bladder surgery, now with 4 5 buttonholes we are able to do such level of surgeries with excellent oncological outcomes. Patient ICU stays restricted. There is no blood loss, so no blood transfusion. Pain management is better, and that is why hospital stay is better. Now, once the patient is less inside the hospital, his normal routine comes back quickly, and within a couple of weeks, he is all ready to join his work. So,
Yeah.
this is how the turnover time for that patient has also reduced drastically with the
Yeah.
help of robotics.
So nothing comes without challenges. So what are the challenges you face when you do these surgeries or
So,
treatments?
so I think, when we talk about robotic surgery, indication for the surgery is the first requirement. Like,
Yes.
if we think via CT scan and all the other imagings that this case is apt for robotic surgery, definitely 95 to 99% we are correct that okay, we can do this
Yes.
with ease with robotic surgery. But sometimes if the patient is too much obese, if there is a very small cavity inside the patient body, then sometimes it becomes challenging. I'll just share you,
Yeah.
this morning we did a case of 1 month old baby
Oh.
with robotic surgery.
And
And
for?
for the baby had a bilateral pelvic ureteric junction obstruction.
Oh.
So the baby came from Mangalore,
Okay.
and yesterday the baby got admitted, and we today did the surgery. The surgery lasted 1.5 hours,
Okay.
and both the kidneys were opened up, and the surgery was successful, and the baby is recovering well. So the challenge in such cases, because 1 month is hardly, the baby is, I would say, maybe around 15 to 20 centimeters, so there is hardly any space inside the body. Now in this kind of patients, we require some expertise where we can use minimum instruments and we can do the precise surgery. So these are the challenging cases where robotic do come into a big help, and we can deliver excellent results.
What is the role of AI in these surgeries?
So I would say AI, that is artificial intelligence, now has multiple roles. So I would categorize that AI role in diagnosis, AI role in surgery, AI role in advanced stages of cancer, and AI role in selecting proper treatment in advanced cases.
Right.
So when we talk about AI in diagnosis, AI will be helpful to analyze our MRI, our biopsy report before the surgery, and give us an idea regarding type of the disease.
Right.
Similarly, AI in surgery, now there is a system where we can overlay those MRI images directly on the organ itself. So when we are doing the surgery, the AI image, the MRI image will be along with the normal tissues and overlapping over the organs, and we
Yeah.
can do a precise surgery. Suppose how much distance we should keep from the cancer, how much pressure we are applying to the organ. All this thing can be assessed with the help of AI, so that we can avoid inadvertent resection, we can avoid positive margin rate, we can avoid cutting off any important structures, and all this helps us to reduce the complication. When we talk about AI in selecting proper treatment for advanced cases, so what actually we do is we get a biopsy.
Yes.
Then this biopsy we run through some genetic test.
Yes.
So the AI has a capability to diagnose what are the genes which are affected by this cancer, and then we can select a particular drug which will be acting only on that gene. So all this, what we call as a genetic signal profiling, is already happening and will be very much implemented in routine care of all patients, because now the time has gone where one size fits all. Now we have to be more specific, more selective, because each individual is different, each cancer is different. So giving a common drug for all cancer doesn't work now. We have to be very specific and select whether we require an immunotherapy, a checkpoint inhibitor, whether any hormonal drugs. So all this can be tailored, custom to the patient with the help of AI.
Yes, right. Sir, please elaborate that resume treatment and Eurolift also.
So both of this treatment, like I told you, are a part of MIST, that is minimally invasive surgical therapy for benign prostatic hyperplasia. We call it as a BPH, or a benign enlargement of a prostate, that is a non-cancerous enlargement of the prostate. Now resume is what? It is like a steam. It is a gun which has a needle, and that needle delivers a steam which is at 103 degrees Celsius. So what actually it does is, we select the area of the prostate, that is the lobes which are enlarged,
Yes.
and we inject that needle inside the prostate through the urethra only. uh, what that needle does is it delivers a steam. So the steam condenses on the prostate cells,
Yes.
which are non-cancerous obviously, and that steam delivers a thermal energy to these cells. So now there is a denaturation of the cells happening, and the cells starts dying with us our cell program, that what we call as apoptosis.
Okay.
So the body mechanism comes there, they start removing the damaged cells,
Yes.
and this is how the cavity opens up. So within 1 to 3 months this process is at its peak, and depending on the size of the prostate, the eating up of the damaged prostate cells is happening. So after 3 months, if you see, there is a big cavity formation inside the prostate, which is what we normally do when we do a laser surgery or what, where we create a cavity. So here the advantage is that without cutting, without any damaging the normal structures of the prostate, we are able to deliver the same results with the help of steam.
Yes.
So all those sick patients who are contraindication for surgeries, who are on heavy blood thinners, those cannot undertake any form of anesthesia. This can be done as an office procedure under local anesthesia, and the procedure duration is 15 minutes. So this is where the resume has, I would say, just made the management of prostate quite simple.
And this can last for 10-15 years.
Yeah, so we have at least 15 years data now, because the technology was first introduced in, I would say, 2011-12. So we are in 2025, and so a good 13 years data is available. Similar say goes for urolift. So urolift are the staplers what we use to lift the prostate. So it is basically called as pull, prostate urethral lift.
Okay.
So it opens up the passage which is draining the bladder. So any prostatic enlargement which is compressing the urethra can be lifted with the help of urolift. Again, this is a minimally invasive surgical treatment, and the procedure duration is 10 to 15 minutes, and patient can go home on the same day.
Okay. And recovery?
So with resume, we tend to keep at least 10 days of catheter,
Yes.
because the steam what we deliver, we it takes some time for the prostate swelling to come down.
right.
For urolift, it is a immediate therapy, and it is a mechanical solution to a mechanical problem.
Yeah.
Because in a way that, because the lobes are pressing against the urethra, with staplers we can open up those lobes, and we can tuck it to the side of the prostate, and the urethra opens up. So for urolift, we don't require 10 days of catheter, only a single day catheter is good enough, and patient can come back next day, remove the catheter, and is all okay.
Sir, what are the problems younger generation are facing because of this lifestyle changes and global warming? What they should understand about this condition?
So, see, previously it was thought that the urology problems only come in the, I would say, the middle age or the old age. But now when we see lot of younger people suffering from different kind of problems regarding regarding urology, I would like to share some of the findings what we see routinely. So first thing what we see is the psychological stress
Yes.
what this younger population have because of the work pressure, peer pressure. They don't have a proper dietary pattern. They don't sleep properly. They, most of them are working at night, and they sleep in the morning. So the entire circadian rhythm is affected. Many people are engaged into smoking, and so this all things affects the genital nerves in a bigger way. Smoking is directly related to increase incidence of cardiovascular events, and similarly the first artery to be affected is the penile artery. So most of the chronic smokers do come to us with a complaint of erectile dysfunction. So, and normally it is seen that if a younger person complains of erectile dysfunction, after 2 years he is bound to have a heart attack. So there is a direct correlation, because of smoking, processed food, sedentary lifestyle, zero exercise. All these factors influences the health in general, and the first organs which are affected are the genitourinary organs.
Okay.
So there is a direct correlation. I explained it to you. Now regarding the erectile dysfunction, we have often seen that they are chronic smokers, sedentary lifestyle, lack of physical activity, increase intake of processed food, and most of them are non-vegetarians. So all these factors blocks the penile artery, and that is why the erectile dysfunction happen. Another most common problem what we face in younger population, especially is male infertility.
Yeah.
So predominantly, again the environmental factors play a bigger role,
Yes.
and they need to modify it so that the quality of sperms are maintained, and they have to have an active physical life, and they should cease all those are which are directly detrimental for the sperm quality.
Yes. Right.
Another important thing what we see in males is that because they are sitting for longer hours on their laptops and at the workplaces, they develop a condition what is we call as a bowel bladder dysfunction.
Okay.
So what happens is they become constipated, they are not able to pass motions daily. Second thing is the bladder, whenever they go for passing urine, the flow doesn't come out and they have to strain while passing urine. So all these are behavioral problems.
Yeah.
So once the younger population, and these problems are reversible if detected early. Now most of the patients who come to us, they have suffered from this problem for at least 10 to 15 years, and they want an immediate solution. So immediate solution is not going to be possible because it's a chronic habit which has led to this problem. And now a proper counseling of the problem, proper diagnosis, I would say, not to urge for surgery immediately in such patients, because they are in their active life.
Yes.
They might be producing babies, so we don't need to immediately opt for surgery in such patients. In fact, we have to counsel the patient and give them the options of yoga, meditation to relax the pelvic floor muscles so that the urination and all becomes all right. And with the help of some medicines, we can at least 40 to 50% we can reverse this condition without the help of surgery. So a proper diagnosis, counseling, and some behavioral therapies definitely help for such population.
So the way we take care of women, and the way we celebrate Women's Day, so we should celebrate Men's Day also. And men should also take care of their health. So one message for men health.
So I would say that in India right now, we as males, we need to be more aware of our general physical health, and we should get ourselves regularly evaluated, especially after 50 years of age, mainly in terms of genitourinary problems, which are precursors to many other major problems happening at the later stage. So it's always better to get yourself tested, evaluated, screen if there is a family history of any malignancy in your family. And I would recommend that do start taking care of yourself, and I would encourage to you to visit a urologist if you face any of the urinary problems.
Can we subside the enlargement of prostate without surgery?
So, see, normally what happens, prostate is a slow growing organ. So, normally the size of the prostate is less than 20 grams. But after 50, each and every male individual is bound to have some enlargement of the prostate. Some enlargement are between 20 to 40, some are between 40 to 60, some are between 60 to 80, and some who are hardcore non-vegetarians and those who have higher androgen levels, their prostate can increase more than 100 grams also. In world right now, there is no medicine which can drastically reduce the size of the prostate. Sometimes what we come to a scenario where patient is unfit for any procedure or any intervention. In such cases, we use some hormonal therapy to shrink the prostate, but that is only in worst come worst phases, because any treatment what we give has some side effect. So for reducing the size as such, there is nothing much what we can do. Some medicines are there, but they are associated with another side effect which affects the body testosterone level. So we don't encourage much, because what happens is, like females have menopause,
Yeah.
males also have something called as andropause.
Yes.
So andropause is what the testosterone deficiency happening in males. So that is very difficult to treat, because those males will be having osteoporosis, heart problems. So rather than reducing the size, we have something like we discussed, Resume and Urolift, which is a minimally invasive option for managing prostate without cutting, burning, or doing any advanced surgery. So these are the options right now. That is why we call it as a mist. There are minimally invasive options which are helpful without creating any much trauma to the normal organs and delivering excellent results for the patient.
Okay. So tell us about you, how you became uh, most famous uro-oncologist from Pune.
So my journey is quite, I would say, fortunate.
Yeah.
When I was a resident, I got selected by Urology Society of India to attend a urology program in Singapore,
Oh, great.
where we had a good exposure to uro-oncology. This I'm talking about 2014. I was one of the two persons to be selected and representing India at
Great.
that forum. And then subsequently in 2015, I had an opportunity to visit American Urological Association conference in New Orleans, and there I got the best poster for my research work on kidney cancer. And at that year, I was the only Indian to be awarded a poster award. So
Yeah.
that was quite fascinating for me also, and that
Yes.
kept my interest in uro-oncology. And subsequently, then I got selected for my robotic fellowship in uro-oncology for Singapore, and
Yes.
then how the journey began. Lucky for me was that my center at Amrita Institute, Kochi, we got the Da Vinci XI system. So that was the one of the first systems in India in
Yes.
2015. I'm talking about,
Okay.
and I was the first resident to get trained on the robotic system. So my passion for uro-oncology and robotic surgery continued, and then in 2017 I came to Pune and joined Ruby Hall Clinic and decided to open a dedicated uro-oncology center at Ruby Hall Clinic, Pune.
Great, sir.
And same year we got the robotic system also. So it was like a icing on the cake, and we started doing robotic surgeries for mainly for uro-oncology. And now we do almost all specialties like we discussed,
Yes.
pediatric, bariatrics, GI, colorectal, and everything.
Yes. It's great, sir. Thank you so much.
Hello friends, I am Dr. Himesh Gandhi. I'm Director of Robotic Surgery, Head of Uro-Oncology at Ruby Hall Clinic, Pune. And today I'll be discussing some myths and facts about the genitourinary conditions in males and how the male's health needs to be given equal importance when we come across our population, and especially in India where we have a higher incidence of male problems coming up pertaining to any age. So please stay tuned and listen to this podcast. And if there are any queries, you can definitely get in touch with us.